Okay, well, let's get started. We do have a lot to cover today. We're going to have a big focus on actually showing some live demos of our AI-powered tools for caseworkers. So before we get into the demos, I'm going to briefly introduce the Nava Labs Technologist-in-Residence program. Then we'll jump in to show the tools that make up our Caseworker Empowerment Toolkit before we hone in on our most recent prototype, which is applying voice AI to caseworker workflows. And before we wrap up, we're going to zoom back out, just reflect on key learnings we've identified from piloting the caseworker empowerment tools so far and share how that's informing what we're going to be exploring next. So I'm Diana Griffin. I'm our principal product manager, and I'm very delighted to be joined by my Nava Labs colleagues today, Ryan Hans and Greg Jordan Dedamore. Ryan and I are both members of our Technologist-in-Residence program, which is a relatively new program within Nava Labs, where our focus is really on exploring the potential of AI and other technologies to support caseworkers who help families navigate and enroll in benefits programs, as well as accessing community resources. And our goal as technologists in residence is to build and ship public prototypes that test emerging approaches to public service delivery in really small, safe, controlled ways. And our prototype development is grounded in Nava's broader work across state and federal benefit programs, as well as Nava Labs' work over the last 2.5 years developing and piloting the Caseworker Empowerment Toolkit. So these caseworker empowerment tools are a set of open source AI-powered tools that Nava Labs has been building across multiple agencies and nonprofit organizations, all focused on giving caseworkers time back to connect with families and access benefits for community members in need. And in this session, we're going to briefly review these tools and then share some of our more recent work exploring different modalities for interacting with them, and that's specifically our early stage prototype of a voice-powered tool to support caseworkers in their interactions with clients. So because we have a lot to demo today, we're going to get right into it, and I'm going to pass it over to Ryan.
Hello, everyone. Thank you for joining. Uh, for those of you who were like me and got really wrapped up in the World Cup, I hope you're finding something else to spend your attention on. And we're very excited to show a lot of demos today. So I'm going to share my screen. And okay. So we're going to go through a collection of tools that are all part of our Caseworker Empowerment Toolkit. And we have caseworker.navapbc.com to check out most of the things I'm sharing today, other than the new voice one we're exploring. And so all these tools are open source, AI powered, and they're all designed around supporting caseworkers in every step of their journey, connecting families with the social safety net. So some of these could be used in state agencies. Some of them could be used in nonprofit organizations that help people find, apply for, and actually receive benefits, and local resources that support families. So these all kind of start to string together and support different aspects of that experience, and we'll dive into them. So a few things up front, we're going to be demoing a lot of different tools. So things will hopefully go well, but just as I'm switching through screens, we'll get through all of these tools and show the different aspects of the role that they support. So we'll dive into the first one, the referral generator. And so the problem here is that case managers must search across disconnected resource lists. They have to check eligibility, and then they have to translate what they're finding into practical next steps for a client. So sharing a list of 10 different resources without any prioritization or tailoring of information can be a challenge for clients to actually find out what might be useful for them and their needs. And so the AI support here is a tool that uses client details to identify relevant, trusted resources. And then the sort of LLM flavor here is around generating a personalized action plan that reflects any prerequisites, potential barriers, locations, and just anything that helps a client get up and running with a resource. And so each of these four that we're going to be sharing up front were either piloted or scaled with a partner. And this referral generator was piloted with 2 Goodwill regions for case workers who help connect clients to career training, but also basic needs resources that help people feel prepared to be set up for success in a career. And so the regions were Goodwill Central Texas and Goodwill Keystone area. So you'll see that this tool is kind of tailored to that context. So we'll dive through it and go through the interaction. So imagine you're a caseworker, you're having a conversation with a client, you're trying to support their career goals, and they mention that they are looking for utility support and electrician training programs. So a nice part of this tool is that it can, handle multiple requests in the same prompt. We will say they live in downtown Austin near the UT campus. Again, we can use natural language because we're using an LLM to power all of this, so it doesn't have to be exact addresses. It can be landmarks or zip codes. And then we can also narrow it down by resource categories or resource provider. In this case, we'll just leave it open-ended. And then we'll find the referrals. And this is pulling from a selection of Goodwill's internal programs and resources that they maintain and gather, especially around the job training aspect. And then also pulling from trusted web resources. The goal here is not to rebuild community resource providers, but to most effectively use resources across various different trusted sources. So you can see our first one here is a rent and utility help run by the Austin Public Health, and they have a variety of different neighborhood centers, community centers, and then we see one of Goodwill's resources here, the pre-apprentice electrician program that they offer. So we'll have this collection of resources to choose from, and we will go with that first neighborhood center and the pre-apprentice electrician program that Goodwill offers. And so this is where the AI aspect really comes more into play to actually try to start pulling these things together and putting them into context for someone to figure out, like, okay, this neighborhood center might offer support for utility assistance. How do you actually get access to it? And then links to websites with more about them. See the utility info here. And we see that phone number that I recommended. And then the same thing for the Goodwill program. So actually kind of breaking down all the steps someone might need to go through to actually get access to these programs, rather than just giving them a list of a lot of websites and phone numbers without a lot of guidance. And so all of these are generated by instructions to an LLM. So this was the format that we came to by working with Goodwill case managers, and it's adaptable and could be tailored to whatever is the best fit for what will actually help clients get access to these resources. And then here we can see the main sources used. And then we'll complete the referral interaction by actually sharing it with the client. For our pilot with Goodwill, we had the ability to print it. We'll just do the action plan so we can hand this to a client or email it to them directly so they can hopefully get access to both this utility support and the electrician training. So that's the main loop for the referral generator. And we can imagine our interaction with the client continuing. Let's say they've continued talking to us and we need to look up more information about a program, SNAP, Medicaid, whichever it may be. And then as a case manager, we hear often that the time and effort to navigate the details of program information can be a real challenge, especially if you're supporting someone with a kind of variety of different programs. So the AI support here is the assistive chatbot, which can retrieve program rules and provide plain language explanations across a variety of trusted sources. And then the sort of extra flavor for our version of it is a direct quote citation from these sources that can't be changed by the LLM to give more confidence in what we're sharing with people. So you get a little glimpse of what this looks like before we dive into the demo. And this one was also piloted. It was piloted with our partner Amplify's Benefit Navigator tool. And that was used by a variety of different community organizations in the Los Angeles area. So people who might be supporting clients with any number of programs and might have expertise, say, in CalFresh, but not as much in Medicaid or other programs. So to take a look at what that interaction looks like, we have a demo here. And so we'll use the LA County version of it, but you can imagine how a interaction like this could be tailored to a variety of different needs, a variety of different sources. So we have a lot of paid family and medical leave demos as well. But we'll go with the LA County one. And then we'll say, client is interested in getting health coverage through Covered California. And we've predefined all of the sources that the chatbot can use, so it's not just going out and using anything from the internet. So we're getting an overview of Covered California here. We start to see the citations here. And that, again, is kind of the unique flavor of this chatbot where you can actually see direct quote citations. We can open them and actually view the source where it came from and verify that it is accurate information before we share it with the client. And so for this one, for most of the quotes that have a direct quote citation from a web source, you'll actually see the quote highlighted, so you can be even more sure that what you're sharing with the client is actually coming from that source and is as accurate as possible. So the other part of chatbot interactions is that we could follow up to ask questions in Spanish, and we can adapt this to different scenarios. So I'll very quickly show a more internally focused one where we're using standard operating procedures for paid family and medical leave program. So to review medical, you're really getting a lot of my live typing skills today. And this one, instead of using different trusted sources about programs that might be public, is just using internal documents about how to review a medical certification. So the flexibility of sources is very powerful here, and we can see these sample SOPs that we've created to review a certification. So can adapt it to either support that interaction when a client is in front of you, or use it to focus more on these internal processes like reviewing documents and all of the procedures that go along with it. So that is the chatbot demo. And there's a very great evaluation report of our pilot with Amplify and the Los Angeles County community orgs on our website. So if you're interested in the evaluation side, there's a lot of great info for this chatbot tool. Okay, so we've found resources. We've generated an action plan. We've talked to our client about some of these programs. We've found information about procedures to help us do our internal tasks. And now we will go more into the document side of things. So for people who work in and around these different programs, we know that most everything requires some sort of documentation to be submitted. And problems we hear from case managers is that determining what's required is complex. Actually extracting information and seeing if everything is meeting the requirements takes a lot of time. And a lot of these tasks are kind of routine. So we're not talking about, is this document meeting the requirements to approve someone for a benefit? We're talking more about just how do we gather the information that is actually being shared in the document. So that's what the AI support is for this version of the tool. It will help categorize documents, extract data, and provide real-time quality feedback to avoid things like blurry documents or things that are just completely not in the right category for what we're looking for a given situation. So this one is implemented currently in one state and is actually scaled across their benefit portal and is really being used for a lot of applications. I think it recently passed 1 million documents processed. And then another pilot is starting soon with another state. So this one getting a lot of traction in the state benefit side to help avoid things like blurry documents or things that really affect a client's application timeline. So to view what this interaction looks like, we will start with consent. This is something we explore with all of our pilots and all of our tools. So we're in a scenario where maybe we're helping this client, Morgan, apply for a general benefits application. This is a generic demo scenario. And we'll have content to either read to the client directly or for them to see on the benefits portal as they're applying for benefits to explain, yes, this is AI, and here is specifically what it is doing and what it is not doing. So being clear that it's just extracting general information, it's not actually reviewing things, and their choice of whether to use it won't affect their eligibility. So we will use it today, and we will use an identity document, but this could be used for basically any document that might be involved in the benefits process. So we'll upload an identity file. And here we've also been experimenting with an interesting process of using ChatGPT's image generator to create synthetic documents of different types to help us expand our testing in addition to sample documents or redacted information. We're using ChatGPT to help generate documents across different scenarios so that we can be more confident in the tools we're developing. And there's a Substack blog post about that if you're more curious about that side of things. So we'll use this sample identity document. You'll see it here, and then it'll just take a few seconds to run through the process and extract the information for us to review. And so this is sort of a generic starting point, but document AI workflows can go in many different directions. I already mentioned some of the implementations of this are actually on the client side to help you avoid submitting a document that might not be readable if it's too blurry or not the right size or format, helping people catch those errors before it results in a delay to their application. We'll just give that a few more seconds to run. And thank you for your patience. This is in a demo environment, so sometimes things are slower. Okay, so we got an error with that one, so we'll try again. And then if this is just an error with our demo environment, we'll show a quick demo video to show what this looks like. And there was a past demo day a month or two ago where the Maryland team that is working on implementing this shared a lot of their progress too. So you can see more about that in that demo day recording as well. We were ambitious demoing 4 tools at the same time, but let's see if this one goes through. Okay, so not working today, but we'll show what this looks like. here. And I'll just kind of scrub through this video quickly to show how it looks like in the portal. And again, there's a full demo day with more details about this tool. So here we see a client-facing portal where people can upload documents. They've uploaded a blurry income document, and the tool has flagged that this seems blurry and may not be accepted by your caseworker. Try another photo or document. Yes, it's going to stay on this one quickly. So again, the goal here is to surface these potential errors that would prevent a caseworker from actually reviewing this document earlier on in the application workflow so that the timeline to review them isn't affected. So we'll try one more file, but in the meantime, we'll move on to our next demo, which is the form filling assistant. And so here we've kind of talked about a lot of the other aspects around a benefit program other than the application itself. And so this tool really dives straight into the interaction of actually filling out an application. And so talking to caseworkers, we know the time, the complexity, and duplication of entering the same information across different forms is really burdensome, both for staff and for clients, and is only kind of multiplied the more applications you're supporting. And so the AI support we're exploring here is an agent that helps caseworkers quickly complete benefit applications by gathering available data from different case management systems and pre-filling forms. And so these are forms that are not controlled by the organization. So the agent is able to adapt, say if they add a different form field or the application changes in some way. And so this one is being piloted with Riverside First 5 in California and is being tried out by a group of 20 or so different caseworkers in that area. And they're learning a lot about this new way of interacting with AI tools that are taking more actions compared to something like a chatbot or the referral tool. And so we're learning a lot about that, about the experience, what's going well, what can be improved. And I believe next month's demo day is going to be from that team sharing more of their results. So much more to come on this one, and we'll get a quick demo of it too. So again, put yourself in the mind of you're talking to a client. They're potentially interested in WIC, and you want to continue talking to them about some other aspect of getting ready to have a baby, but you also want to get this form filled out because you know they're eventually going to apply for WIC. So we'll use a sample client. And we'll choose that WIC form. So we'll see a lot of things happening at once, so I kind of narrate it. On the left, we should see the AI tool pulling up this form. It should be pulling information from our demo version of Apricot 360. So I see a question about that. Yes, the full version is integrated with Apricot 360, which is a system Riverside uses to keep track of the clients they're working with. And after a little bit of startup time, it should start to pull information. You can see it getting the record and starting to pre-populate some things. So here we have our sample client, Rosa. We have the data the tool is able to pull about Rosa. So we have most of the information we need to fill out this form. And it's flagging anything that is missing or ambiguous. So you can see I can infer this based on zip, but I'm going to ask, meaning it's going to ask me, the case manager, to confirm. And so we will provide answers before we fill out this form. Does this client have Medi-Cal? No. And they are pregnant. And they authorize their WIC appointments to be virtual, in-person, and telehealth. And then we'll let the AI choose the closest. So we've provided all that information, and the tool will start going through this form and using the information that we've both pulled from the system of record and then provided as additional context to fill out this form. So you can see it chose the closest WIC clinic because we asked it to, it didn't assume. And now it's filling out the information, and then it will stop to confirm everything before it submits this form. So we'll just stop it there, and we can see how this interaction, as we get more and more seamless, could allow me to delegate this starter kind of routine work of just entering information into a form. This could be going on while I'm talking to my client about what actually matters to them, which is having a baby and getting support. And then I will review this application before it gets submitted to make sure everything is correct and get this client on their way to getting WIC services. And so, of course, this is a single page web form, and it's one application at a time at the moment. So there's a lot of interesting explorations around how do you support longer applications like Benefits Cal in California, which this tool can do. And then a future exploration and theme around how do you reduce the repetitive data entry, say if this WIC application is using 80% of the same information as a Benefits Cal application? How do you make that more and more seamless so that case managers can focus on their clients? And again, there will be a demo day next month from this team where they're sharing more about what they're learning from actually testing this and talking to people at Riverside who are trying it out with the families they're serving. Okay, so I'm going to stop sharing for a second just to get myself reset, because now we are pausing and all of those tools have either been piloted or implemented at scale with different partners. And then one more shout out to our caseworker.navapbc website where you can see more about all of these tools. But this next one is even more future facing. This is the kind of first time we've shared it in a larger public setting. And it is all around kind of the voice workflow. So I will start sharing my screen again. And just pause for a quick drink of water because there's talking in this one since it is in fact voice. Okay, so for the voice to case note workflow, this is a theme we've heard from caseworkers since we've started this program about 2.5 years ago, that case notes, client notes, visit summaries, documentation like this is what caseworkers spend much of their day doing. A lot of it is documenting interactions with clients, and it really increases their administrative burden and distracts from their casework. Of course, these are also very important records to have for things like documenting services provided, showing where services are going, who is being served by a program, and then also for clients themselves to have records of what's going on with their case manager in many circumstances. So very important to do well, but also a very big source of burden for caseworkers. So the AI support we're exploring here is transcription to document conversation, flowing into a human review to go over what was extracted to boost the accuracy of the outputs. And then both case note drafting, so on the client side, a case note, and then on the caseworker side, a case note, on the client side, a plain language summary, so they can have an easy way to learn, to remember what was shared, what's next, and more details of what was going on. And so this one, like I said, early prototype, testing it with navigators, very good initial feedback. We know there's a long trail to go from a demo that people have good reactions to a well-evaluated tool that we can trust in these kind of very important scenarios where getting information wrong can potentially have a lot of negative impact. So we will move into the demo for this tool. And if you notice, kind of all of these tools have a little bit different visual styles. That's just because of the context of each one is a little bit different. The partners, et cetera, have led to different design approaches. So for this one, we'll go through a little bit of setup. So we have myself acting as the case manager and Diana acting as the client today. The provider that we're using for transcription in this demo, at least, is called Assembly AI, and it has real-time support for Diana and I to talk and for the tool to live transcribe and assign speakers. And other languages we know would need to be supported, and they are by that provider, but the quality level and the level of real-time information would vary for those other languages. So just an aspect of this area that we're aware of, especially as we try to explore the way AI can boost accessibility to different services. We'll be in English today, and then we just have a few settings here to make sure it can get my Zoom audio. And then the first step here, like all of our tools, is consent. And so we just have a very high level starter point here, but we know we should be able to have clear talking points about where is this information stored, how is it being processed, can I not allow you to record an interaction with me, and having scripts and plain language ways for us to explain that for all of our tools is important. So starting that exploration early on for this one as well. Okay, so we'll move into a sample interaction here. So Diana, before we start, I'd like to record this conversation so I can have accurate notes for your case. This recording is only used to generate this case record. Is that okay with you today?
Yeah, that's fine with me. Thanks for asking.
Great. Okay, so we'll start this meeting. I will find my Zoom tab to get Diana's audio. And this is how we've set it up for today so that we can get myself speaking. You can see that showing up in the transcript. We know there's a lot of different context to make this work. But to introduce myself as a case manager, hello, I'm Ryan. I'll be your caseworker today. I understand there might be something around utility support you're looking for. We'll have a few questions to see what emergency assistance may be available. So can you tell me a little bit more about what you're coming to the office today for?
Yeah, so I got a notice. Riverbend Electric says the service is going to be disconnected next Thursday unless I pay $612.
Okay, and do you have the shut-off notice with the account number and due date?
Yeah, I have a photo of it I can send you. Let me see here. The account number is 8843221001. And it says the payment's due July 30th. And it's for my house at 482 Larkspur Lane in Springfield.
Gotcha. And as we continue along the process, if you're able to text us a photo of that, it'll help us get you connected to support faster. Another question we ask is, who lives in the home with you?
Oh yeah, so it's me, my son Marcus, he's 16, and then my dad lives with us. His name's Walter. And my dad needs an oxygen machine at night, so that's something I'm really worried about here.
Okay, and what caused this bill to fall behind?
Yeah, so I was in a car accident in May and I missed work for 2 weeks after that. I'm back at my job now, but I could only pay rent and groceries.
Gotcha. And this can be a rough estimate, but about what is your monthly income from work right now?
Yeah, so before the accident, it was around 2,400 a month before taxes, but last month was last month was way less. It was just about 1,000.
Okay. And does your father or anyone else in the household have any income?
Well, my dad gets Social Security. It's about 1,280 a month. And he gives me 400 of that towards rent, and he buys his own prescriptions from the pharmacy.
Okay, great. Thank you. We'll add a same day review task for our team today. So we'll get working on that right away. If you can text us the shut off notice today and any papers you have for your father's medical issues and oxygen machine that will help the process. And I'll text this list to your phone number, 704-555-0148. And we'll
Thank you so
pause it
much.
there. Okay, so you might have noticed me kind of switching between tabs, and that's because we're exploring this idea of how much information do you present someone with as they're having a conversation with someone. We can have the full transcript showing with all of the details, all of the ums and ahs and kind of back and forth, which might be useful in some cases. Probably too much information for a lot of people as they're trying to have a conversation with someone. So exploring ways to have, interactions where you really don't see anything. You just see the fact that the system is recording and that you can pause it and about how long the conversation is going. So just enough feedback that you know the system is still working. And there were little alerts when new facts were observed. And that was the other exploration in terms of kind of synthesizing what is coming out of a conversation. So these key facts that were happening that I could add more to as we go. I know Diana's last name, for instance. So we're, getting the key facts of a conversation, trying not to overwhelm people. And then after we've finished the conversation, we'll end it and then send it to be synthesized. And so the next screen we'll see is a review screen, which will ask us to double check anything that the LLM is not as confident in. So we have one that it flagged as needs review, about the car accident and only being able to pay rent and groceries. We can see the transcript and double check it. And we'll accept this one. And then after we've reviewed all the facts, we will hand it over to the next step, which is actually drafting a case note. And this template can be whatever an organization is finding most useful or has to use. So we have just sort of a generic template here with contact reason, circumstances, actions taken, next steps. And this is all just instructions to an AI tool. So very easy to update as needs emerge. And then on the client side, we have a simplified version of that is easier for someone to actually act on. So key information, documents requested, next steps. And this could also be in the client's preferred language. We did this interaction in English today, but if we either talked in Spanish or there was some sign that the client's preferred language was Spanish, we could have the case note be in English for documentation purposes, and then the client summary be in Spanish to actually share with the client in their preferred language. So a lot of interesting potential here about what this output could be. Another aspect we're thinking about is, we saw the form filling assistant work, and we know we've just collected a lot of information in this session that could be used for a actual application after we've reviewed it and verified it. So early days in that respect, but we know there's probably a lot of potential in using these voice ambient AI interactions to actually flow into application forms, case notes, whatever the format is that would most drive the outcomes we're working for, which is getting clients and families connected to the resources that would benefit them. So because this is just a demo, these don't actually connect to anything yet, but we're already thinking about how do you make sure this is all being done securely? We're obviously talking about very private information. So there's even a mode that actually takes all of that out before it gets sent anywhere. But if we were to pilot this, we would, of course, have all of these LLMs hosted securely so that we're not just sending Diana's personal information to chatgpt.com. But that will be the end of the voice note interaction. So a lot of big potential here, a lot of different ways the outputs could be reviewed to increase quality, a lot of different formats that could help move outcomes forward and reduce burden, both for caseworkers and for the clients they serve. So that will finished the demo section of today. Thank you for going along that ride with me. I believe I just set the record for most demos ever done in one session. So we know they didn't all work perfectly, but hopefully you got a good sense of how these tools not only work individually, but how they connect to each other and how they build kind of an ecosystem of tools around caseworkers to really support what they're trying to do with the clients they serve. So for more on that, I'll pass it to Greg for how we think about mental models for this work.
Hi, everyone. Now we're going to take a step back from the demos and both look back at a lot of the lessons we've been learning across these different pilots, as well as look ahead at what we think are some important principles moving forward and some areas that we're going to be exploring and we expect to see exploration in this space in general. One exciting thing has been just the general receptiveness when talking to a lot of agency administrators and frontline staff. Like, people are often quite enthusiastic about this. And it's not entirely a shock because, in part, we did a lot of user and stakeholder research several years ago that informed which use cases we were going to pursue in the first place. But still, it's exciting, like after we do all this work and build these things, to see that people do, in fact, find it exciting. I'll say a couple months ago, I was at a childcare conference. So, not a tech conference, not an AI conference, nothing like that. And there were people who stopped by our booth who I just walked them through the tools, kind of like how Ryan just showed. And you just sort of seen the way that a lot of people's faces lit up, saying, like, yes, like that's the exact problem we have. And like, oh, yes, this is such an issue. Like, this looks like it could be so helpful for us. And so it's been great hearing from so many people in so many different contexts who see a lot of potential for these tools in their work. This is an example from one caseworker who was saying, we always talk about having to keep inputting all the data again. This would save so much time for us. And in terms of numbers, we've seen a lot of really promising results. Across all of our pilots, we do a lot of program evaluation work and we partner with academic researchers at several universities. So we've really been digging into a lot of the data on this. For our assistive chatbot, we actually, our academic partners, there's an NSF funded study, and we found that it's estimated to improve caseworkers' question answering accuracy by about 40%, with stronger improvements for more difficult questions. So that's very exciting to see. They did a randomized controlled trial. We have a whole big report on our website that you can read if you want. For the referral generator, as another example, 66% of the Goodwill case managers who were using it said that it increased their confidence in identifying appropriate referrals, and 58% said it reduced the amount of time that they were spending on finding them. And for our form filling assistant, as Ryan mentioned, we have a demo day coming up in a little over a month, August 27th. We're going to have the page up on our website soon. And we will also email out, when we email you the link to the recording of this presentation and some other things, we'll include the link for that as well. There were also some surprises. So there were, for all these different tools, there are ways that we hypothesized that they might be used, benefits that we were hoping they would have. And a lot of those we did see, especially, for example, a lot of these were imagined to result in time savings. And indeed, we have found time savings. But there have been some surprises in terms of, for example, for some projects, like one of the biggest findings was things like more confidence in answers, or all sorts of other things that we've been really digging into. So that's been incredibly exciting. Also, something we've seen with some of our tools is, although there are great numbers in terms of our results and lots of enthusiasm, we've simultaneously seen some declines in usage over the course of a pilot. So we've been digging into that more to see kind of what's the issue there. What does more long-term sustainability look like? How might we integrate these tools into people's workflows, into their existing case management systems? So it's not just like a new thing on the side that they have to remember that it exists. So yeah, we're really excited by everything we've been finding, including the more surprising things, and just wanting to learn more about those. And as a result of a lot of the learnings that we've had, and conversations that we've had, we have a few key principles that we think are important for how responsible use of AI can help make public services more human. One is no screen in between. So we think it's really important to emphasize the human interaction at play. And in fact, some of these tools can help enhance that. So if you think about our agentic form filling assistant, right, without that, you could have a situation where a caseworker and an individual or family are there and they're at the computer together, having to fill all these forms. And the idea here is that some of this can just run in the background so that they can put more of their focus on the face-to-face conversation. We're not looking to put barriers in front of human interaction. Another is transparency about what these AI-powered tools are doing. So you saw a few different examples of that in Ryan's demos. So you saw the voice AI tool was showing where it's getting different pieces of information from. Our assistive chatbot is citing its sources, and you can click straight through to those links. The agentic form filling assistant is, has little things showing, here are all the things that it's filling out. And we think this is really important. In general, you just don't want AI to be a black box where people don't know what's going on. But B, especially in these contexts of, a lot of times we're working with sensitive life situations, all sorts of issues like that, sensitive data. Also, in many governments and among the public, there may be a bit of a trust deficit based on past not so great interactions that people may have had with different government agencies. So we really we want to be transparent, and we want to focus on building trust and making sure that these tools are trustworthy. Another is that the humans stay in control. So you see examples of this throughout the different projects. In the document AI tool, as you saw, the tool is not doing determinations. It's not saying this document is approved or it's rejected, and your application for benefits is rejected. It's not doing that. It's supporting the humans in decision making. So it's flagging things like, oh, it looks like this utility bill might be missing an address, or oh, it looks like this picture of your driver's license might be too blurry. Maybe consider uploading a new one. But it's not going to stop you. If you want to click to proceed, it'll let you do that. The agentic form filling assistant, it's filling stuff out, but the caseworker can press pause at any time, and the tool is not doing the final submission. It's always the caseworker who is hitting that final submit button and is reviewing everything and ensuring that it's ready to move forward. And another is that we want people to only have to tell their story once. So a lot of these situations that are involved, people may have, they be carrying different sorts of trauma, all sorts of things. People who may have just lost their jobs, there may be sensitive family issues, and we don't want people to have to keep repeating these things over and over to different people and sort of reliving all these things that are already like you may not really want to be thinking about it to begin with. And so we really want to maximize the extent to which information that has been shared can be plugged in wherever it needs to be, rather than forcing people to have to keep saying it over and over and over again. And I guess in general, you could say, tying these together, these AI-powered tools can help navigate systems, they can help fill things out, analyze things, whatever, but the human work still belongs to humans. And we think that's really important, both as a lesson we've learned, but also a design principle. And looking ahead, there are a few topics that we expect to dig into, and we think many folks in this space will be digging into. A big one is the question of cost and cost-benefit analysis. There are a lot of trade-offs involved. When you're doing an experimental pilot project, you can try a lot of things. But when it comes to what would it look like to use these longer term, cost is a big issue, especially for government agencies where the use of taxpayer money is something that comes under a lot of scrutiny. Many of you may have seen articles in the news about companies who are having exploding bills of how much they're spending on different AI services. So it's really important to make sure that we're being considerate about costs we've certainly been working hard on our tools on reducing costs. So if you imagine that agentic form filling assistant, like there's a cost per each application that's submitted in terms of the AI usage, and we're trying to get that down. But there's also questions like, what does good enough look like? Do you have cases where maybe you have diminishing returns at some point where sure, adding on additional AI tools and features and usage may help in some ways, but not as much as some of the earlier stuff did, or some of the more basic features. And is it worth it? So that's an open question, and it's obviously different in many different cases. There's lots to dig into, but it's very interesting. And then also there are a lot of contexts these days in which people are experimenting with AI for things that you don't really need AI for. And so there are some cases where just regular old automation can be cheaper and more reliable. So really carefully fine-tuning, like what are the situations where AI is needed or not. So yeah, there's lots of things to look at on the cost benefit front. And so many other things. One is sort of multi-layer AI, or sort of AI working with AI. So Ryan showed a great example with sample document generation, right? So we had our document AI tool that's analyzing documents. Then Ryan is using AI, ChatGPT, to generate sample documents so we can test our document AI tool. So there are all sorts of interesting possibilities to dive into on that front. Another that we think is going to be a big topic is local LLMs. So locally hosted instead of using cloud services, both from a cost perspective as well as specifically for governments. There are a lot of concerns about privacy and security. So that's another one, and we will probably have blog posts on that in the near future. Our team's also been looking a lot at AI policy and what's going on in that space. So we've got more to come on that. We'll be publishing soon. We'll probably have a demo day in the next couple months. So we are so excited to dig into these topics and so many more, and just excited about everything going on in this space. So we would love for you to follow along in our work. Specifically, we'd like to highlight, we just launched a Substack recently. For those of you who are not familiar, it functions as both a blog and a newsletter. So you can just visit the site and check out the posts, or you can also subscribe and get them in your email inbox if you'd like. This is intended, so if you imagine our main Nava website, we still have our case studies, toolkits, results of different things. This is more of a look behind the scenes and a look at work in progress. So Ryan, as you can see, he posted here, he has posted about the voice AI tool that's just kind of in the early prototyping stage. A post about the sample document generator. We're going to have a lot more coming soon. So we're really excited. We'd love for you to follow us and engage. It has a comment section. And the reason the comments are important is it can help guide our work. So I know a lot of you have been posting questions. There's different topics that you're particularly interested in. We would love to hear about that. Please do comment on our Substack posts, email us at labs@navapbc.com, because that may affect what we dig into when we're doing all of our evaluation work, right? We have tons of data, tons of interviews, all these things, and you may have ideas of angles of things to explore where we go back and look at it and say, oh, that's so interesting. Like we hadn't looked at that, and we would love to share that out publicly. This is also helpful for knowing, like, when we do future demo days, what might we focus on? Well, we'd love to focus on things that you all are interested in. So really, we'd love to hear from you and use that to help guide the things that we share with you, in the hopes that that is impactful for you in your work, in your organizations, and to the field more generally. So yeah, please do reach out, comment, interact. There are many ways you can follow our progress. We will share these links in a follow-up email afterward, so you don't have to furiously copy these down. But yeah, we will share out an email with a link to this recording and all of these different resources. So now we will move on to a very brief Q&A.
Yeah, with just a couple of minutes, I really appreciate the questions that have been coming in. We're unfortunately not going to get to all of them, but I think this is a great example of cases where your questions might turn into future posts or future share outs that we can answer in more depth in another format. So for example, Lauren, I see your question about measuring AI-based tool performance over time. That's a fantastic question. that I don't think a 2-minute answer will do justice, but a great topic for us to be posting about in more detail. Maybe I saw one kind of bigger picture question that might be a good way to zoom out to wrap up. So question about when you're doing intakes in a state with kind of multiple good tools or multiple systems in play, what are the obstacles in sharing and grabbing data between systems? Is it legislative? Is it about the walls between federal, state, county, the systems themselves, their kind of ability to integrate easily? So maybe to end on that bigger picture note about how all of this plays into the landscape, Genevieve, I'll let you speak to what we've learned there.
Sure. I know the question is specifically about California, but I'll zoom out for just a second and then I'll answer for California specifically. So it really depends. It depends where you are. So many of our pilots have been very local, so either direct service organizations, county governments, etc. But even at the state level, there will always be certain federal statutes that have hard walls for specific data types. So that's just like kind of the water we're in around, tax and income data, things like that. And then program-specific federal rules, like for SNAP, TANF, and Medicaid, all have their own data handling requirements. So at the state level, there's always kind of that, how well has the state lined up all of those pieces. When we look at a place like California specifically, I hope I'm getting this right. I think they're county ministered for CalWORKs and CalFresh, and then county and state for Medi-Cal. So there's 58 California counties, I think, and everyone's going to have the big, systems they're consolidated into, but they'll also have their own record keeping. So there'll be some variance in, local policy, implementation, business processes, what are the data quality practices between those things. And because the counties are often owning that client relationship, they need to get the data to the state, but we'll also see counties doing things in local governments and frankly, direct service organizations investing in their own systems where they're trying to have either better connectivity or better referrals between places, which is where things then get kind of like architectural. So any like legacy systems, if there's not great APIs, integration might mean like a 24-hour, kind of data snapshot rather than a live pull out of a system. So then how are we working with that? And then often when we have lots of systems, even if they're very good, there's not always a universal client identifier across all of them. So identity resolution between those things can get complicated, especially if the data models are inconsistent between systems, which they often are because they're usually designed for certain programs and to work with them. And then, then the question becomes one of governance, of client consent, and different states, agencies, counties, organizations are always kind of at different places in that journey. And I think we've seen, especially over the last 2 decades, really ambitious runs at like universal client identifiers and things like that at state levels. And I think it's like there's places where 2 programs or maybe 2 agencies have joined really well, but we've kind of yet to see like a full holistic, totally wraparound, like you can connect into and out of any system super efficiently. But we're very interested in the ways that agents might enable more multi-system orchestration. Are there ways to abstract away some of that complexity? So we're thinking about that internally, but haven't gotten to the haven't gotten anything ready for a demo day yet. Yeah, I hope that's helpful. Thank you so much for that question.
And that brings us just a little bit over time. Thank you so much for joining today and for these thoughtful questions. We really look forward to sharing our next steps across these tools and hopefully answering some of the questions you've brought up in some of our future posts and share outs. So thank you again, everyone, for joining today.